out our surfaces, all right? We want to clean out those developmental grooves as much as possible. And after your doctor's diagnosed the sealants that you're working on, you're going to go in and clean out each tooth. Okay, so we'll do the 3-7 as well. And just using a little bit of flour pumice. You don't want to be using prophy paste because prophy paste, of course, has, it's got fluoride in it. Okay, and we're going to come here. Even though we're not doing it, I'm just showing you we're going to be cleaning those all out at once. Okay. Section. Clean all that out. So it's really important when you're doing sealants that you have everything ready and available. So I know the camera is not on my tray here, but I have everything within arm's reach, okay? Because once you start doing your sealant, you're generally doing sealants on 6-7-year-old kids, and you always have to have your isolation. You don't want to sort of abandon their mouth with the isolation, because if you're trying to keep things dry, they will close. Oh, are you changing the...
Yeah, just carry on.
Okay, so I'm explaining to my patient, especially if they're a child, I tell them that I'm going to be putting little coats of armor over their teeth, all right? Oh, yeah. Hello.
So I just wanted to show you Lorna's setup.
Okay, so everything is really close. I can reach over. Ooh, I got to do some more tricep. So I have everything close by, so I can quickly grab it, okay? And because once I get isolated and I leave the mouth, they're going to close, and then they're going to contaminate everything, and then I have to re-etch. So I don't want to leave the mouth unless I absolutely have to, and I'm always telling them to stay open, all right? So I've done my prophy, or my pumice, and I've gotten my cotton roll, my Garmer cotton roll holder. So,
Can I ask a question?
Yeah.
Do we ever use a bite block?
You know what? Good question. You can use a bite block, but look at who you're using it on. So if you want to use a bite block on the left-hand side and they can tolerate it, go ahead. But you're putting Garmers, you're putting in dry angles, you're putting in possibly more cotton. Is your child going to be able to handle it?
The one and only sealant that we had was a 5-year-old, and she had a little
Bite block? And if they can tolerate it, that's great.
Okay.
Yeah, if that works for them. Because when you introduce a bite block, and if they've got a really small mouth and you're putting in a Garmer, where are they going to put their tongue? And they always want to push stuff out of their mouth. But you're constantly giving them encouragement. Okay, stay open, don't close. You know, you're walking them through this. Okay, that's a good question. Yeah, so bite blocks can be used. Okay, so I'm going to put in my Garmer cotton roll holder. And remember with your Garmers that this bump right here, it goes over the incisal edge on the anterior, okay? And that's going to get clamped underneath the chin, all right? So I love Garmers just because they make your patients stay open, but I always have a tendency to keep my finger in their mouth, okay? So I've done my pumice. I'm going to dry the tooth off really well. I'm going to get my etch, and I'm going to etch our tooth. So with my etch, I'm just going to put the etch on the areas that I want to apply. All right, so you know that the etch, when the etch goes on, it's going to create little micro tags. And so this is real etch, and it kind of came out a little bit runny, so I want to make sure that it's not going to drip down. I mean, even though we do have the Garmers, I don't want it to get on their tongue. I don't want it to get on their cheek. All right, I'm keeping my finger in their mouth. And how long do we keep our etch on an enamel surface? What's the time on that? Do you remember? What was that? 20 to 30 seconds, because we are etching enamel, so it does have to stay on a little bit longer, okay? So let's just say we've got 30 seconds going. I've kept my finger in my patient's mouth. I'm going to put my etch down, and I've kind of traded fingers. I'm going to get my air water syringe. I'm going to hold that there. I'm going to grab my HV I'm going to put my HVE right over the etch, just like we did with our composite filling. I don't have any water. Here we go. And I'm going to rinse that off for about 20 seconds, okay? And if there's anything in the back,
That's a good question. Laura, Jenny Ann had a very good question. She asked if it would be possible to clean, etch, dry, and fissure sealant two adjacent teeth. And I said, yes, as long as they're adjacent, okay, but you couldn't do like a 3-6 and a 4-6.
No, I'm just thinking if both of those molars, 3-6, 3-7.
oh, totally. Do them both at the same time.
At the same time?
Completely.
Okay.
If you're doing full quadrants, if your doctor has prescribed 4-4, 4-5, 4-6, 4-7, do them all at once.
Okay, cool.
Do them all at once. In some cases, I've done a 4-7 and I've done a 1-6. You know what? The patient's open.
Yeah.
And all I do is I put a dry angle up for the maxillary, and I've cleaned them and I've etched. And because it's on the right side, I can do them both.
Okay, cool.
Okay?
Okay.
But yeah, if the teeth are adjacent to each other, by all means, do them both at the same time.
Okay.
Okay? So I've rinsed off my etch, and what I'm going to do is I'm just going to double check my etching, and I'm going to make sure that it's that nice white chalky appearance. And I'm going to get my sealant material, my Clean Pro, okay? I'm just going to extrude a little bit on my glove just to make sure that it doesn't leak out too much on my tooth. And when I apply it on, I'm only going to put a drop into the developmental groove, and I'm just going to kind of spread it with the tip, okay? With the applicator tip, and just spread it around. Now what you can do, if you find that the material is pooling, because we don't want too much of the material on the tooth just because it will create a high occlusion. What you can do is you can get one of your little bender brushes, like the Barbie ski poles, and you can absorb some of it. But you can apply it with the applicator, or you can apply it and spread it out with your Explorer, okay? And make sure that you get it into the accessory grooves. Make sure you get it into all the little grooves there. And I don't think you can see this, but can you see how it's kind of pink, the material? And as it's starting to set, it's actually going to turn white. It's going to go clear, all right? So when I run my Explorer through it, I'm taking out any voids, any bubbles. And then I'm going to put my,
And then maybe talk about the bubble groove too.
yes. Actually, when I have a molar tooth here. Sweet. Yeah, I can show you that. And then I'm going to cure it for about 30 seconds.
Sorry, I have another question.
Perfect.
So during the video, I can't remember who did the
Donna.
video, but she was saying have the patient hold the curing light in a paddle so that you can maintain, I think it was to maintain moisture control, or there was something that you were doing.
That's just a Donna thing. Yeah.
Okay.
We all have our little tips and tricks.
All right.
Is that appropriate or no?
Oh yeah. Well, like
I would get them, if anything, I would get them to hold the suction. If
Okay.
it's somebody you need to keep their attention, I would get them to hold the saliva ejector.
And you make sure the light's in the right spot.
I wouldn't let them hold the light.
Okay.
I wouldn't,
Okay.
no, so.
I just wasn't sure because it was on that video.
Yeah. Yeah.
Okay, I'm hearing a lot of chit chatter. Are you guys listening here?
Yeah.
Okay, so now I've cured my sealant, and then when I check my sealant, I'm going to get my Explorer, and I'm going to run my Explorer over the sealant, and I'm checking for voids. I'm checking for little ledges, little, like Jenny Ann said, little margins. Bubbles. If I find bubbles or voids, I'm not going to take off my isolation yet. Okay? I'm going to make sure everything's dry. I'm going to get my sealant material, and I'm going to fill in that void with my sealant material. Okay? And then I'm going to get my light, and I'm going to cure it again. All right?
Jenny Ann had a good point about the video. It's an older video, and Donna, the lady who filmed it, would have her patient hold the light. I would never have my patient hold the light. Lorna had mentioned if you want to give your patient something to hold on to, give them the LVE.
Yeah, let them hold on to the saliva ejector and tell them not to close. But the whole time I'm doing my sealant, and especially if I'm working on a young child, I'm walking them through it. And I'm telling them, okay, if you show them this, what are they going to think? You have a needle. No, I tell them, I'm gonna put some soap on your tooth, okay? I'm gonna wash off your tooth with my special soap, and we know that soap doesn't taste very good. So I need you to stay open, all right? So I'm cleaning off your tooth really well. Now I need to rinse off the soap, and then I'm gonna put on my sealant material, my little coat of armor. And if you walk them through it, and you kind of engage them with what you're doing, it'll help them be a little bit more interactive, all right? So before I take off my isolation, I've checked my sealant. I've made sure that it's nice and smooth, there's no ledges, and there's no voids, okay? There's no catches. Sometimes if we get a catch or a void, sometimes we can actually flick off the sealant. And if that happens, then you have to redo the sealant over again, okay? It became contaminated. All right, so now that I know my sealant is adhered to the tooth, I'm gonna take off my isolation. I'm not gonna let my patient close, only because with our sealant material, it's a resin material, and there is uncured resin that sits on the top. Has anybody tasted uncured resin in their mouth? It's bitter. It's horrible, well, just because you're in my line of sight. It's very bitter, so I don't let them close. I just say stay open, and I'm gonna get my either saliva ejector or my suction, and I'm gonna clean off the top of the tooth, or you can get a gauze, and you can just wipe the top of the tooth off, and then let them close, all right? Because especially with children, and if you can't really reason with them, and they have that taste of it's very bitter, sometimes they won't let you back in again. So always try to get them to stay open. Make sure that the area has clean and cleared of that uncured resin, okay? So I've done my sealant. If I'm doing multiple sealants in different quadrants, I'm gonna do my inclusion last, all right? But in this case, I'm only gonna show you one, and then I'm gonna move on to doing it on real teeth. So I'm gonna check the inclusion. I'm gonna get them to bite down, and normally, because they're not frozen, they can tell you, and I always say, does it feel like you're biting on high heels? Does your teeth feel taller than the rest of them? And they either say yes or no, all right? And make sure that they're not posturing, right? Make sure they're not bringing their jaw forward or moving their jaw back. Get them to bite down. And if you have a high spot, then we are licensed. This is where we're gonna switch out our contra angle. So this here is a prophy angle. This is what I used to clean with the pumice, all right, because it's a screw type. And I've got a different contra angle here, and this is my latch type. So this is what you're familiar with your restorative. And we have two types of burrs that we can use to adjust the occlusion. And so we've got a large, round, slow speed, and we also have a white polishing burr, all right? So they're both latch type. And when you go to adjust the occlusion on these teeth, what you're doing is you're actually just using the side of the burr. You're not going to use the very top of the burr, because the top of the burr there's no cutting mechanism on the very top of the burr. You're only going to use the side of the burr, all right? You're not going to cut a tooth. You remember with restorative, with the round burr, what it does is it takes out the soft decay. So with removing the high spots on a sealant, you're only going to use the side of the burr, and you're just going to do gentle sweeping motions, just like that. You're not coming straight down, you're going in on the side, all right? And you're just going to touch on the area where there's a high blue spot, okay? And I'm going to get them to check it again, right? How does that feel? And generally you can tell by the look on their face. They're like, oh, that feels so much better. All right, so I'm going to check it with my, where is my articulating paper? Tap, tap, tap. Okay, that looks good. And what I can do is I can even go back. I can even go back with my white polishing. And also same thing, use the side, don't use the top, okay? Because that's got a very fine tip on the top. And I'm going to polish it just on the side, okay? Just like that. Come in this way, okay? And just give that a nice little polish, okay? And then I'm going to give it a rinse. I'm not getting much water, there's no water here. Oh, that's because... Okay. There we go. So any questions about the sealant? The patient is comfortable. The occlusion has been checked. and the sealant has adhered to the tooth properly. Any questions at this point? No? So, we need just to fill up our water here. So just give us, there. There. So now what we're gonna do, as soon as we get our water, I'm gonna show you on